I'm Thomas Godfrey, and today I want to talk to you about Faktr. Faktr is a soft tissue treatment concept developed by Dr. Tom Hyde out of North Carolina and stands for Functional and Kinetic Treatment with Rehab. Now, the first thing that Dr. Hyde really stresses is that Faktr is a concept. It's not a technique. It's not ART, PIR, MRT, gua sha cupping. Though you can use those with the Faktr concept, it's not the same. So with PIR, ART, those things are actual techniques, and those are tools that you can put into your tool bag, whereas Faktr is a tool bag in itself. So Faktr is going to be used to treat a lot of musculoskeletal injuries, so as far as ligaments, tendons, and muscles. Now, there are a few contraindications, obviously, so things such as burns, cancer, fractures, you want to stay away from those areas, as well as patients who have increased risk of bleeding and other things like that. So today, I figured I would take you through a typical treatment and go through all 5 stages of the Faktr progression. So Samantha today is going to be our patient. Back in 2011, she tore her LCL and dislocated her patella laterally. So today we're going to do a little bit of work on that and see if we can make some progress. So first off, the first progression for Faktr is going to be putting it into the position of provocation. Now, I know normally when you want to treat a patient, you take them out of the position of provocation, you know, make them a little bit more comfortable, take them out of pain, and treat them that way. Faktr, we want to do the exact opposite. We want to put them into that position of pain because we want to see what's causing it, and we want to treat them from there. So, as far as treatment-wise, you can use PIR, MRT, gua sha, and all those other things. My personal favorite is instrument assisted. I think you get really good results out of that. And so this is just your typical adhesion breaker you can buy online for 160, 170 bucks. And this is just your typical, cocoa butter that you can use just as a little emollient, just so that you're not grinding metal on skin. So, okay, let's go ahead and get started. So again, the first position is going to be the position of provocation. So for Sam, the main positions and movements that hurt her most are squats, especially when she's down at the bottom range and getting ready to start coming back up. So first what I'm going to do is I'm going to have you turn towards me and go ahead and put your leg up on the table. So with the squat, you typically go down to where your knees are probably about 90 degrees, maybe a little bit more. And so, squats, it puts a lot of stress on the knee. So first what we're going to go ahead and do is we want to really work the lateral aspect as well as right over the incision. Because she did have surgery, so there's going to be a lot of scar tissue and adhesions underneath the actual incision mark itself. So we'll go ahead and start working there. Now with Faktr, your treatments are only going to be about 30 to 90 seconds. You really don't want to go further than that because you can start really causing some damage and things like that. Now, as far as Faktr, the whole reason why we want to put it into the position of provocation is because it provides an immediate response as far as reconstructing those fibers and putting them back into the line that they should be. So for the first position, you're going to go ahead and do about 30 to 90 seconds on. And you can already see some of the adhesions and scar tissue and stuff like that breaking up on her knee. So that's the first position. Now the second one is going to be the movement of provocation. So again, for her, it's squats. So we're going to go ahead and have her stand up. I'm going to have her perform about 5 air squats, and like I said, mainly it's when she's at the bottom range, so I'm really going to work on her when she's at that bottom range. So whenever you're ready, we're going to go ahead and just do about 5 air squats. Okay?
Yeah, good.
Okay.
Really good.
Alright, so that's the second one. Now the third one is going to be resisted provocation. So we want to put her through that motion of provocation again, so the squats. But this time we want to put a load on it. We want to make it a little bit resistant. So typically what you can do as far as squats, you can throw a dumbbell or a kettlebell in their arms, or you can throw a bar on their back. This is going to be the easiest way. Or you could put them on the table, throw a TheraBand around their ankle, and make them do the knee extensions, things like that. But so we're going to go ahead and have her just do a typical goblet squat. And take her through the range of motions again and keep working on this area. And you can't really see it, but her knee is just really red, and you can just see a lot of the adhesions and scar tissue breaking up. Okay, so that's the third progression for Faktr. Now the fourth progression is going to be just your functional activity. So for her, there's really no functional activities that cause pain other than the squat. So in this instance, you can kind of roll both the second, third, and fourth all into one because it mainly hurts when she does that actual squat position. So now the fifth and final position is going to be adding in a little bit of proprioception. So we want to put her onto an unstable surface. Now we're not going to make her do full squats because that's, you know, if you have someone that's recovering from an injury and you want to put them on an unstable surface and have them do squats, I mean, that's a good way to re-injure themselves. So we'll go ahead and just do a normal balance test. I'm just going to have her stand on it and just have her knees bent just slightly and go ahead and just balance for me. Okay? Okay. Good. Okay. And so now we're just going to go ahead and just work the area again. Just, 30 to 90 seconds. Now with Faktr, you're not going to take a patient through all 5 progressions in one treatment. You're going to gauge where they are through all your different orthopedic testing to see just how strong they really are. Okay. Like I said, you want to see how strong their muscles and tendons and things like that are. And then you're going to gauge where you're going to start your treatment from there. So if they're just post-surgery, you're not going to start them on, the third or fourth level. You're going to start them on the first one, putting them statically and just working that way. So the thing that I really like about Faktr is that it's really low tech. I mean, everything that you see here you can purchase for $200, $250, and it provides really good treatment for the patients. Now, this is your typical Faktr treatment. Now, personally, what I like to do, and what I've seen a lot of Dr. Hyde's videos and things like that do, is they like to tape to kind of back up their work. So what we're going to do is, my personal favorite is I love Rock Tape. I think it's a great product. I think it's probably one of the better taping products out there. So what we're going to do is we're going to go ahead and tape her knee. Normally you'd kind of clean it off. I thought I brought a rag with me, but apparently not. So you want to make sure that the area is nice and clean. Now for her, again, she has that lateral traction issue, so it really starts wanting to pull outward because of the weak VMO. So for this, we really want to put a block on that lateral aspect to help keep her knee tracting the way that it should. So I'm just going to go ahead and take it here. So what we're going to do is you want to find the lateral aspect of the patella, so it ends about right there. And so you want to put about a 50% stretch on the tape. That way we get a nice good block right there. You'll put that down. And then you're going to do about the same the rest of the way here until you get to the last little bit, and then it's just paper off tension. It's nice and light. You do the same thing up through here. And just paper off tension there. You just really want to rub it, get it nice and activated, get it working, make sure it's nice and stuck. So personally, like I said, I really like Rock Tape. I think it's a great product. I think it really helps stabilize things and keep the work that you just did in order. It doesn't allow the patient to just kind of fall back. But obviously, once you put the tape on, we want to go ahead and make sure that it's going to be comfortable for them. So Sam, go ahead and stand up for me and just go ahead and do a couple air squats. Just see how it feels. Make sure that the tape is, holding and that it feels somewhat comfortable.
No, it feels great.
Good? Okay, perfect. So that is your typical Faktr progression. There's the 5 different stages. There's multiple different things. And that's the thing I really like about the concept of Faktr. You're not limited to just PIR or just MRT, gua sha. You can use all these different things within the Faktr concept. And I really think that putting the patient in the position of provocation is the way to go. I mean, if you find out exactly where it's hurting, you can treat that area, and you're going to see some really good results. So, like I said, I really think Faktr is a great concept. I fully plan on using it in the future. So, thank you, Sam.
Yeah.
And thank you for taking the time to watch this.